Welcome again to Save Your Money, Save Your Teeth, the go-to podcast where curiosity meets dentistry, straight from the experts. I've got our expert here with us, as per usual, Dr. Clifford Yudelman from OptiSmile, ready to take a deep dive into the world of dental care, especially from a consumer's perspective. So whether you're looking to brighten your smile or protect your wallet, this podcast's got you covered with practical advice and the latest insights. So stick around with us for the next half an hour or so as we uncover the secrets to maintaining both your dental health and your finances. Today, we are talking about hydration and oral health. Apparently, there's a surprising connection between the two, and Dr. Yudelman is going to tell us all about it. Dr. Yudelman, welcome back.
Thanks, Ian. Great to be back and great to hear your voice once again, and looking forward to today's podcast and also next week's, which is along a similar line. We're starting to look at health aspects of sports and hydration, things like that. So fire away.
This sounds very, very interesting. I want to ask you firstly, how does plain water directly help prevent tooth decay?
So we've had some podcasts early on in the series about diet and tooth decay and pH in your mouth and so on. So basically, when you drink plain water, still water, or even tap water, it dilutes and washes away any dietary sugars or acids before bacteria can ferment them. So it's the bacteria that sit in the plaque that eat the sugars and the acids, and that's what causes cavities. And every time you sip on water, it stimulates more saliva flow, and your saliva has got natural minerals, especially calcium and phosphate, and that hardens early enamel cavities that you may be getting. Not all areas of Cape Town have got fluoride in the tap water, and even some still waters that you get, say from Kauai or some of these places, mineral waters. They sometimes just take them straight out of a spring, and they've got some naturally occurring fluoride. They obviously check that it's not too high. But basically, you get a little microdose of fluoride, a very tiny amount, which also helps to harden your teeth. And, a well-hydrated mouth maintains a neutral pH, which is around 7, and that cuts down the time that the acid has to attack your teeth, which is the critical pH, and we should remember this going forward, is 5.5. So above 7 is alkaline, and below 7 is acidic. So something like a pH of 6 is not going to harm your teeth. And a lot of things are around a pH of 6. It's slightly, it's got a slight flavor to it. If you've got a little hint of lemon in some water, just a tiny little touch, it could drop the pH to 6. It's not like pure lemon juice, which is a pH of, say, 3. So let's remember the threshold of 5.5, because we'll be coming back to that shortly.
Okay, and sparkling water, could that be eroding my enamel without me knowing it?
100%. So unflavored carbonated water is mildly acidic, which can be a pH of 5.5 and has no sugar, and the risk is lower than juices or sodas. But having said that, if you look at, say, you've got expensive taste and you get some sparkling or carbonated mineral water that's naturally carbonated, like Pellegrino, because of the minerals, Pellegrino can actually, last time I looked, had a pH of 7, which is actually, good for your teeth. There's some sparkling waters. My wife likes sparkling water, and there's some that are available in the supermarkets in South Africa, and they got surprisingly low pHs below 5.5. So do have a look. I think one of them is Valpray. I don't have a bottle in front of me, but Valpray or one of those others that's available in the supermarkets has got a very low pH. And if you're just sipping on sparkling water all day, you're just melting your teeth away. We've spoken about erosion before. When I was in Australia, you got these soda streams, which were very popular. And I have had patients here that come in and they say, oh, all my teeth are very, very sensitive. And I say to them, when did you buy the soda stream? because soda stream water is about a pH of 3.5 to 4. And, these numbers are not, they logarithmic. So if you drop from a 5.5 to a 4.5, it's about 100 times more acidic, if I'm not mistaken. I'm not a scientist, and it's been a while since I studied that, but these numbers are not just like, oh, it's just a little bit more acidic. If you drop from 5.5 to 3, it's hundreds of times more acidic and more damaging to your teeth. So the damage occurs mainly from the frequency, because people sip on these carbonated waters and it keeps your enamel bathed in the acid. Whereas like drinking a glass of sparkling water or a bottle of sparkling water when you're eating is safe. But it's when you've got a bottle and you open it up and you have a sip and you close it quickly. Plain or citrus-free is better. As soon as you got flavored sparkling water, they say no preservatives or no sugar. They often add citric acid. As soon as you see citric acid in anything, that drops the pH below 3. And citric acid is particularly damaging to enamel. It's the worst, one of the worst things. And the 20-minute rule, finish your drink promptly so that the saliva can rebound the pH back up to normal, instead of just having like a slow, you keep hitting your teeth with acid all day. Drink the whole bottle down and be done with it.
Okay, well, that's interesting. But so obviously we know hydration is very important. Does overall hydration status affect your gum health too, or is it just your teeth?
100%. So when I practiced in America, particularly, people walk around with a 2-liter Avion and they sip water, plain water all day, and they're very hydrated. They lie down for you to check their teeth, and within seconds their mouth is full of saliva. In Australia and South Africa, we don't tend to drink as much water as Americans. Maybe it's the marketing, I'm not sure, but we generally have very dry mouths. We drink a lot of coffee, and we think a little bottle of water. The young people are much better, the ones that go to the gym and walk around now with their big 2-liter, who knows what, they filter it at home themselves, and it's a glass bottle. That's very important. People are very anti-plastic, but I'm getting off subject. But basically, adequate fluid take keeps your saliva, you have more saliva. As I was just saying, the saliva has got things called immunoglobulins and other antimicrobial proteins or peptides, and these suppress gum disease bacteria. When you've got chronic dry mouth, you get like a thicker, stickier plaque or biofilm, and that accelerates gingivitis and bleeding. Also, when you're well hydrated, you've got better blood flow to your gums, so your gums get repaired much quicker. And there are a lot of studies that link low salivary flow to inflammatory markers. When you're hydrated, those inflammatory markers improve. These are inflammatory markers in the fluid that comes up between your gum and your tooth. So it's very good to drink lots of plain water.
And just how much water is ideal for healthy teeth and gums? We don't want to overdo it.
So I was doing some Googling, as one does, or these days chat GPTing. I don't know if that's a word. But, they recommend around 2 liters a day for adults at sea level, and you adjust it upwards in hot areas, or if you're doing strenuous exercise. One can look it up, but it's definitely a lot more than most people drink. I mean, personally, I don't drink enough water. I like my squeezy plastic bottle. I get one every so often from Kauai, and I rinse it out and I reuse it. I just supposed to not have any plastic, bad plastic in it. Who knows? But I fill that up, and that's only 500 mils. I'll sip on one and maybe fill it up once during the day. So if I drink a liter of water a day, personally for me, that's a lot, but it's do as I say, not as I do. The simplest check is they say your urine should be very pale or straw colored. If your urine is very like dark yellow or orange, it means you need to drink more water. I won't comment further about urine here. I think it's a little bit off subject, but that's supposed to be a good way to tell. Spacing your intake rather than just knocking it back, that's supposed to be much better. Steady sips keep your saliva levels stable and your pH neutral. They say for every coffee or alcoholic drink, you should have an equal amount of plain water, because those coffee and alcohol cause you to pee more. It's called diuresis. Basically, it's a diuretic. So there's a good tip for you right there.
And I also want to ask you, Dr. Yudelman, is it true that staying hydrated can actually reduce bad breath?
Yeah, so if you remember back, our very, very first podcast was before Valentine's Day last year.
Yes.
What was that, 2024? And it was all about reducing bad breath. And one of the things is, if you have a dry mouth, you can have these volatile sulfur compounds, which is that rotten egg smell. It's morning breath is caused, you wake up with dry mouth because your saliva turns off at night, and the moist tissues deter or stop these anaerobic bacteria. These are the bacteria that hate oxygen. So if there's moisture in your mouth, it keeps those ones down. And saliva physically sweeps away any food particles. A lubricated tongue keeps your tongue fresher. You don't get a thick gross coating on your tongue. And patients with dry mouth or medication-induced dry mouth often get dramatically bad breath or halitosis. And as soon as you start using more liquids, drinking more, and also using saliva substitutes, which we've discussed before, these things help your breath.
I also want to ask you, why do some patients experience dry mouth even when they drink plenty?
Yeah, that's a good question. The first thing I ask patients when they complain of bad breath or dry mouth, and they say, no, I drink a lot of water, I start asking about medications. The most common thing is people with allergies, especially the traditional type of antihistamines. So antihistamines dry up your nose, but they also dry up your eyes and your mouth. And that's a common one. A lot of people these days, especially since COVID, are on antidepressants. And if you read the side effects of antidepressants, many or most of them can cause a dry mouth. And then older patients that are on blood pressure meds or things that help to slow down your heart called beta blockers, these all cause reduced saliva gland output. So obviously, mouth breathing during sleep. We did speak about mouth taping. That's a good one to listen to, and especially during exercise. So if you're in the gym and you're running on the treadmill and you see maybe a girl or vice versa, you see a boy that you want to ask out, and you turn off the treadmill and you go hi in their face, you're probably going to chase them away because if your mouth is dry, it probably doesn't. Stop, have a sip of water, have a bit of a swish and then say hi and keep your distance. Yeah. So, a little tip.
Thanks for the tip, yeah.
For the gym bunnies, yeah. And then there's systemic conditions. So diabetes can cause dry mouth, thyroid imbalance, autoimmune disease, things like that. And obviously too much coffee or alcohol, as we already discussed. So it's a whole new world of hydration out there.
And herbal teas or coffee, are these acceptable substitutes for water?
So if they're caffeine-free, 1 cup of caffeine-free tea, a herbal tea like a chamomile or something that's low in acid and sugar, it is a 1-to-1. So 1 cup is like 1 cup. Apparently black coffee still contributes to your hydration, but it's mildly acidic. I don't think the pH is below 5, but when you start adding sugar and then you nurse your coffee, if you make a big pot of coffee, for instance, and you just sip on it all day, that's not going to be good for you. Then green teas have got things like polyphenols, which are things that are good for you, like antioxidant. And the polyphenols in green tea apparently also inhibit the bacteria Streptococcus mutans, which is one of the main bacteria that causes cavities. So that's a nice perk there. The people that drink green tea supposedly get less cavities. I don't get a lot of people that tell me, oh, I love my green tea. I think you see more of it in places like California where I lived. And then sweetened iced teas, like some of these ones you get in a tin, they're terrible because they've got sucrose that undoes all the hydration. They're very acidic. And there is a apparent, like a sports drink. I had a patient come in a couple of years ago and we didn't see him for 2 years. And he came back, he saw one of my associates, and literally every tooth in his mouth had a really bad cavity. And I can't remember the name of the drink, but it's a common, they push it as a sports or a healthy way to keep hydrated, but it is very high in sugar, and they give the sugar a different name. They make it sound like it's good for you, and especially citric acid. So yeah, you've been warned there.
So I suppose Coca-Cola is out of the question.
Yeah, even Diet Coke is very, very acidic.
Oh.
It's got phosphoric acid. Any of these things are fine if you're eating a burger and chips and you whack back a can of Coke and it's done, and then you drink enough water. Everything in moderation. If you have anything in extreme, it can become a poison. So yeah. I'm not saying don't drink a Coca-Cola or don't come home and knock back a gin and tonic, but don't sip on gin and tonic from 5 p.m. until you go to bed. That won't be good for you in other ways as well.
Yeah.
Especially, yeah. But yeah, look, everything in moderation. Exactly. That's what my late dad used to say, especially moderation itself.
Good one. Dr. Yudelman, what role do electrolytes play in maintaining that oral moisture balance?
So your salivary glands rely on the sodium-potassium pumps it's not an actual pump like a bicycle pump, but there's a mechanism that the cells use with sodium, potassium, and they use that to secrete fluid. So if you've got an extremely low salt diet, that can affect it. Athletes that lose a lot of sodium from sweating can get a dry mouth, and so taking electrolytes in a case like that, as long as they're not flavored with citric acid or have sugars and things in them, that will help. We're going to be discussing that in another episode. And there's something called isotonic formulations. Basically, those are ones without the citric acid, and you can sip them quite quickly, knock them back, and then rinse with plain water. So I love cycling, and when I used to do very long rides, I did used to take one of these. Put some powders in the one water bottle, but you always have a plain bottle as well. You've got 2 cages, and you have one with plain water and one with your hydration fluids in there. And after you drink your one that's flavored, you then follow up with plain water, especially if you're doing like a 5 or 6 hour bike ride. You can damage your teeth if you're just drinking only Gatorade type drinks.
Okay, and can fluoride mouth rinses replace the need for regular water intake?
No, absolutely not. I mean, it does boost minerals, but it doesn't offer any mechanical cleansing, doesn't give you any continuous buffering. If you over-rely on rinses without proper hydration, you're going to have thick plaque. I think mouthwashes are completely overrated. In fact, any mouthwash that's like very astringent nowadays, you get a lot of them that don't have alcohol, but some of them got these other natural oils and things like that. They strip your saliva. They can cause dry mouth. Using a prescription or if your dentist recommends a fluoride mouthwash or something called tooth mousse that you use on your teeth before you go to bed, that gives like an extra armor. But water is a main frontline defense.
Tooth mousse, that's quite a name.
Yeah, it's like conditioner for your hair, but you put it on your teeth.
On your teeth, yeah. Exactly. Yeah. And then finally, Dr. Yudelman, what hydration hack would you give to a busy professional on the go?
I always got my little either Mountain Falls or Kauai. I love those like squishy bottles. My son's 20, he's a professional boxer, and he saw I had a glass bottle, and he wanted that. The kids these days are more aware of microplastics and things. I think when you get to my age at 65, you've been eating microplastic your whole life, so we don't we got other things to worry about. Yeah. But keeping a bottle like a half a liter bottle, 500 ml bottle, you don't look ridiculous. Not like walking around with a 2-liter AV on, which I think looks ridiculous, especially in a sling, over your shoulder. It's like, at least you walk around with the extra 2 kgs of weight. That's good for fitness. But yeah, every time you're on a call or you finish a meeting, you can drink half of that or even the whole thing and go and fill it up at the water cooler, have a chat to someone. Fluoride, there's a lot of controversy. I'm not going to talk about fluoride here. In the afternoon, instead of having a fizzy drink, you can make your own, iced rooibos, for instance, which doesn't have acid or caffeine. I'm not a fan of that, but that's just one idea that I've heard about. And you can put reminders on your phone, like every 2 hours. Drink water, don't snack, things like that. That works for some people. Yeah, look, I think we've covered quite a few tips that I think will help people to both save their money and save their teeth. And yeah, look, don't have to buy expensive, fancy water. I've got one of those Brita filters now in the fridge. We had a water cooler and buy those big, whatever it is, 20-liter bottles, but I think filtered water is just as good for me anyway.
Absolutely. And that concludes today's podcast, the surprising connection between hydration and oral health. As always, a big thanks to you, Dr. Yudelman, for sharing your expertise with us and for your time.
Pleasure. Thanks for having me on. And for anyone listening to this, I'm sure they'll find next week episodes, athletes and oral health and how your teeth affect performance.
That's going to be interesting, especially in light of the recent comrades. I'd love to hear about that link. That's going to be very, very interesting. So join us again next week. Thanks to our listeners, as always, for tuning in. And also remember, while we strive to provide valuable insights, always consult with your own dental professional for advice tailored to your personal health. Don't forget to subscribe to the podcast for more enlightening discussions, and do join us again next time as we continue to explore the fascinating intersection of dental health and financial savvy. So until then, keep smiling and taking great care of your teeth.
Discover the world of dental excellence with OptiSmile. Join us for a weekly podcast featuring Dr. Clifford Yudelman, a seasoned expert with 40 years of dental experience across 4 continents. Gain unique insights and expert dental advice by visiting optismile.co.za for articles that illuminate the path to optimal oral health. If you're seeking unparalleled dental care in Cape Town, get in touch with OptiSmile or book directly online on optismile.co.za. OptiSmile, where global expertise meets local care.